Thank you. And I'd like to invite Dr. Dana Millen with the New Mexico Health Security Campaign. Thank you for all your work.
Nice to meet you.
What I'd like to do, please, is just give you an overview of the Health Security for New Mexicans campaign, and also to remind you of who we are. And then maybe we can open it up. Does that sound okay?
Absolutely.
Okay, great. So we've been around since the early 90s, working to set up our own healthcare plan in New Mexico. And we believe now, in this climate, it's time to do it. We are the largest coalition in the state. We consist of farmers, ranchers, labor, faith-based organizations, groups that advocate for the homeless and the poor, healthcare groups, all over the place. We've been around organizing. I'm a community organizer as well as the education and outreach coordinator for the campaign. So just very briefly, what we would do is, I wish I had some water up here. I get all my little yoga thing over there. Thank you. Thank you. All right, thank you. I don't think you do. Okay, thanks. So basically, most New Mexicans would be covered. We have to pass a piece of legislation. Many of you have heard of us, the Health Security Act. We're up to pass our bill. It's time in 2019. We're very excited because we are gaining so much ground. And I see some people smiling. You know us. It's wonderful. And the idea is, first we pass our bill. Then the idea is most New Mexicans would be rolled into one large risk pool. Not everybody can be placed into this large risk pool, okay? Because you have the retired military and you have the military. They have their own health care, which is great. And then you have, and they want to keep that. And federal retirees want to keep their health care, okay? So that's really important that they're protected. The tribes as sovereign nations, the sovereignty issue is respected, and our campaign respects that very much. And so the tribes can opt to join in, and those groups that fall under ERISA, and that would be the labs, Los Alamos Labs, that would be the labor community. We have labor on board, and they contract with ERISA. So what that means is, once our bill passes, our plan passes, 1.8 at about 2 million New Mexicans would be covered under one large risk pool, sharing the risk, we like to say, smothered in red and green chili, because this is our plan, okay? The young, the old, the healthy, and the not so healthy in it together, and that's what insurance is supposed to be about.
Right.
So what that means is they would be in the plan. Everyone would have choice of doctor and hospital, even across state lines, and a really good benefit package. The state employee benefit package is the model that is in our piece of legislation. Good plan. It would be run by an independent commission, not state government, 15 commission. We've heard loud and clear, because remember, we've organized the state, y'all, right? Okay? We've heard loud and clear. People in New Mexico do not want state government running this plan. So it's really important that this is run by an independent commission. 15 geographically represented commissioners around the state. 5 must represent health facility and healthcare interests, and 10 consumer and business interests. We also have many businesses that support this plan because it makes sense. Businesses need to afford healthcare and they can't often do it. Small business can't do that. So the really good employee goes over to the labs for health benefits, et cetera. And then it will take 3 years to get this plan up and running. So we need to do another study, a cost analysis on what does our healthcare really cost? We don't really know anymore what it costs. Healthcare costs are rising. That's why it's time to set up our own health plan. 2 studies have been done, one in 2007, one in 1994, that showed loud and clear when you place most New Mexicans in one large risk pool, you save money and cover most New Mexicans. So we need to do another study, and then it will take 2 more years to get this plan up and running. And that has to be done in a public process. And the meetings are subject, this is like a co-op model. Meetings are open to the public. It's our plan. So my question to you, that said, how will you support our initiative, our plan, our work?
I would, and with one condition. The governor has no authority over the commission and appoints nobody to the board.
Yeah. They don't. Thank you. Yes, yes.
When I first read it, I kind of got the idea that the governor kind of appointed some of the commissioners, and I don't want our legislators and our governor I think as your governor, I care about healthcare and I care about everybody. So I think I'd appoint a pretty good commission, but think if we got someone like Susana Martinez again, who decided to put 13 mental health companies out of business. So
Awful.
as long as our political
Terrible.
leaders don't have any authority over it or have any power to appoint people,
Right.
because then it gets too political. So that was my only concern when I first read the plan.
Right.
Other than
Peter
that,
knows. Peter
yeah,
knows
other than that, and Peter and I talked about that. That was one of the things that says, as long as I don't have any authority over it and the legislators don't have any authority on it.
Yeah.
And I'll be very frank and honest. We talked about my sons. I'm a cancer survivor, so I'm always worried. I'm not worried about getting cancer again. I'll never get cancer again. But I always worry about healthcare costs because of what I went through.
Yes.
I literally spend $23,000 a year for my family on healthcare costs. I'm an independent contractor, so I literally spend $23,000 a year. I spend almost $17,000, $18,000 on premiums. Then I have a $5,000 deductible before I can even use it. And then I caught a cold a couple weeks ago. I went to the doctor and paid a $50 copay.
Right.
And all this other. So literally, my family, 99% of the Mexicans can't afford that. So,
Right.
And then I've seen our healthcare costs just skyrocket over the last few years. So I think there's a couple of things. One, I totally agree with you 100% and favor that. So whether it's and I've looked at 3 different plans, whether it's a Medicare for all or the New Mexico Health Securities Act plan, or some type of plan. And keep in mind, folks, whether you're for this or not, what I do like about your plan is you can stay within your own plan. You can stay within the private plans.
Well,
or
not
the
exactly.
private-
Not
the private
exactly.
plans, but
This switches the role of private insurance into a
To-
secondary role. They can offer supplemental insurance.
Correct,
So if you
right.
need a little bit
a
more,
little bit more.
you can
know,
do that. Just
worried
as they
about
do.
cancer. You worry
Absolutely,
about,
just
yeah.
as they do in other nations.
Right.
Other countries
Right.
have private insurance that offer supplemental plans. But really, we need the economies of scale. We need most New Mexicans in one large risk pool, and we need to switch the role of private insurance. That's what's killing us.
Right.
That's why our costs are rising.
Are rising
And we
so
can be
much.
the first. We can be the mouse that roars in New Mexico.
Absolutely. And another,
Yay! Let's do it!
Well, and
Woo!
there's other things we can look at too,
Yeah,
like data sharing. Our hospitals and our medical groups literally don't data share. So I was with I don't want to say who they were, but I was with a couple of medical testing groups in the last couple of weeks, and they told me flat out that their bottom line is about a third of their tests are double or triple tests, because a patient goes to Presbyterian, they do the test, and that patient gets literally sent over to UNM, and then they do the test for UNM, because UNM doesn't want to share the data, they just want their own test. So these 2 or 3 companies are literally telling me 30 to 40% of their tests are duplicate tests.
Right.
So they know they could save costs by if we went to more database sharing. So we believe in database sharing also. And folks, let me just kind of put it, I've been in the private sector for 32 years. When I first started in business, probably the average benefit cost for small business and businesses was the medical costs were about 10 to 12% per employee. Today, it's about 37%. Okay, so so don't blame small business.
No, it's not the small business.
Yeah, don't blame small business when
No,
they say,
no,
I can't
no.
afford it, because literally small business
No.
will go out of business.
No, it's not the.
It's not the small.
No,
yeah.
and small businesses would have a sweetener because they have trucks, right?
And
And
they
they would
won't-
save on automobile insurance under this plan and workers' comp under this
Right.
plan.
And they're all for it.
Yes, they are.
And here's the one
Yes,
thing, and again,
yes.
like I said, like 2 years ago, I don't know if I'd agreed to single payer, but as I've kind of learned.
And we don't call this single payer, by the way,
Right.
because we are nonpartisan. When you talk about single payer, we talk about this as a co-op model. Single payer often means it's run by the state and everyone's in it.
Right.
We can't do that from a state perspective. And we are talking to tribes. You can't automatically roll in the tribes of sovereign nations.
Right.
There's something wrong with that. So we call this a co-op model, our model, self-insuring our state,
Self-insuring our
basically.
state,
Yeah,
absolutely.
yeah. We don't call it single payer.
Right,
That
right.
doesn't resonate. And we have Roswell on board. We have Roswell, communities like Roswell, all the way to liberal Santa Fe to conservative Roswell.
Right. So yes, if the legislature passed it, I will
Okay.
sign that bill.
Yay! Okay. Lovely.
Thank you.
Thank you.